can't just wait till you get disease and try to claw yourself back to health. It's better, an ounce of prevention is worth a ton of cure. And I'm so glad that you're there in Dallas to share this important information with folks down there, and look forward myself to eventually getting back down to Dallas.
Welcome back to our channel. I'm Maya, and in today's video we will interview Dr. Michael Greger, who's going to talk about how to prevent getting infected with the coronavirus and also what to do in case of future pandemics. He's the best-selling author of How Not to Die, How Not to Diet, and also now his latest book on how to survive a pandemic. He actually addresses the viruses that cause pandemics and how to face them, from tuberculosis to measles to AIDS and now COVID-19. These infectious diseases share a common origin story: human interaction with animals, also known as zoonotic diseases, for their passage from animals to humans. These pathogens, both pre-existing ones and those that are newly identified, have sparked some of the deadliest plagues in history. So let's meet Dr. Michael Greger.
It's not a good time to be crowding people together.
So Dr. Greger, we were a little bit disappointed that we weren't able to see you in person last month, and we were going to talk about the How Not to Diet book, and instead we're actually going to talk about how to survive a pandemic. So thank you for your time today.
Happy to be here. Hopefully next time it'll be in person.
Yes, hopefully. I was just reviewing your new book, the How to Survive in a Pandemic, and the Harvard Modeling Group recommended that we social distance through 2022. Is that something that you're seeing also?
Until herd immunity, it only happens the hard way through mass infection or the right way through mass vaccination. But even best case scenario, we're not going to have anything available vaccine-wise for the general population until the second half of next year.
How did this pandemic even happen?
Over the last few decades, there's hundreds of human pathogens have emerged at a rate unheard of in the annals of human medicine. So wait a second, emerged from where? Mostly from animals. So the AIDS virus is blamed on the bushmeat trade in Africa. The mad cow disease was because we turned cows into carnivores and cannibals. Covid-19 and SARS have been traced back to the live, exotic, wild animal trade. But, our last pandemic, swine flu in 2009, arose not from some backwater wet market in Asia, but was largely made in the USA on pig operations in the United States. And thankfully, swine flu only killed about 500,000 people. But the next time, we might not be so lucky.
That's something that I've had in my mind, is that there's an acceleration of the incidence of these diseases. You go back, the big one that I can think of back in the 20th century was the Spanish flu in 1918. And then there was this long period where we didn't have any major pandemics or outbreaks. And then suddenly AIDS in the 70s, 80s, and then it's accelerating now that we're seeing it more and more often. What do you think is going to happen? Are we going to continue to see this acceleration, and how are we going to deal with it?
Well, we're changing the way animals live on a global scale. As devastating as COVID-19 is, it may just be a dress rehearsal for an even greater threat waiting in the wings of chickens. According to the CDC, the leading candidate for the next pandemic is a bird flu virus known as H7N9, which is 100 times deadlier than COVID-19. Instead of 1 in 250 cases die, H7N9 has killed 40% of the people it infects. The last time a bird flu virus jumped directly to people and caused a pandemic, as you mentioned, it triggered the deadliest plague in human history, the flu pandemic of 1918, killing about 50 million people. That had a 2% fatality rate, right? What if we had a pandemic infecting billions where death was closer to a flip of a coin, right? But the good news is there's something we can do about it. Just as eliminating the exotic animal trade and these live wet markets may go a long way towards preventing the next coronavirus pandemic, reforming the way we raise domestic animals for food may help forestall the next killer flu.
That's a good point you make, but the question is, will we do it? We see so much resistance from many people. There may be people who are like-minded like us who understand there's a need for that reform. Then there's other people who don't accept that that exists.
Well, that's the silver lining of COVID-19, is that this is, it's like a fire drill to wake us out of our complacency, kind of like a dry run. When we, crowd together thousands of animals in these cramped, filthy football field-sized sheds to lie, beak to beak or snout to snout atop their own waist. It's just a breeding ground for disease. The sheer numbers, the overcrowding, the stress crippling their immune systems, the ammonia from decomposing waste, burning their lungs, the lack of fresh air, lack of sunlight, and put all these factors together, and what you have is really kind of a perfect storm environment for the emergence spread of these so-called super strains of influenza. We got to give these animals some breathing room. They are the ones that could use a little social distancing right now. But ultimately, taking a step back, we really need to accelerate the movement toward plant-based options, plant-based milks, plant-based meats, plant-based egg products. It's just too risky to continue to prioritize protein from animal sources.
And that's given us an opportunity to kind of showcase the benefits of plant-based foods, kind of like what you're saying. That's the right way to go. And we've had people reach out to us and ask us to share more content about that, make videos, and help people to cross over from eating these animal-based foods to plant-based foods. You kind of, when addressing the topic of nutrition, what you're saying is that the immune system needs to function at an optimal level, and that's what we can do right now. That's one way that we have control over the situation, right?
Absolutely. All right. Consider the underlying, premorbid conditions for COVID-19 severity and death. Hypertension, high blood pressure, heart disease, obesity, type 2 diabetes, all of these conditions can be prevented, arrested, and even reversed with a healthy enough plant-based diet and lifestyle. And it's important to realize it's not just obesity, even just being overweight, having a BMI of 28, which is like, being 175 pounds at the average American height of 5'6", that puts you at nearly 6 times the odds of a severe course of COVID-19. The average BMI in the United States, 29. So even being skinnier than the average American, you may have so much excess body fat that the level of systemic inflammation in your body is such that you could end up in the hospital or worse. That's why this is the time to take care of yourself. This is the time to, get sufficient sleep, to keep active, to reduce stress, to stay connected, albeit, remotely to friends and family, and start cleaning up your diet, not just for preventing chronic disease down the road, but in bolstering your ability to withstand the current infectious disease threat.
Well, what I like about what you just said too is you're talking about nutrition, but you're also talking about other lifestyle issues as well.
Yeah, no, absolutely. I mean, yes, indeed, diet is the most important thing we do in terms of morbidity and mortality, but it all comes together. I mean, and for immune function, sleep and exercise is critically important. Even, a single all-nighter, one bad night of sleep can really impair one's ability. You do these simple experiments where you drip cold virus into people's nose, and you think, well, if you drip the virus straight into your nose, then there'd be like 100% chance that you'd get the cold. No, because people have immune systems. They can fight off the virus, but you just keep them awake for one night. There's a dramatic increase in the infection rate. And I have a video about that. So little things like that. Look, I have a video about talking about the role broccoli sprouts can play in influenza. You drip influenza virus into people's nose and you randomize them. In fact, there's a double-blind randomized controlled trial, broccoli sprouts versus alfalfa sprouts, and they found that those eating broccoli sprouts not only had less, virus recovery from the nose, less virus-induced inflammation, significantly improved natural killer cell antiviral activity, all from just eating broccoli. Amazing effects, simple tweaks, common sense measures. You don't have to go out and get some fancy supplement or something. Just take care of yourself and your family.
We admire the fact that you're one of the founding members of the Lifestyle Medicine, American College of Lifestyle Medicine, and my husband just became board certified.
Fantastic.
Thank you.
Congratulations.
When you talk about exercise, you mentioned IgA. and that found in the saliva. Can you talk a little bit about how that plays a role in helping us with respiratory issues?
I guess within the context of protecting against, say, the coronavirus or any viral infection.
Can that help?
Yeah, so IgA is a class of antibodies that protect our mucosal surfaces, meaning our mucous membranes, our eyes, our nose, our mouth. That is often where respiratory viruses first attach to then infect us and cause illness. And so presumably, the fact that even just running around for 10 minutes, you can get a significant improvement in IgA production. Suggests that it would protect you against respiratory disease. You certainly see that. You can randomize people to various levels of exercise, and you can show a significant boost in a variety of dimensions of immunity that has yet been put to the test for COVID-19, but encouraging people to exercise just has benefits, no downsides, and so I certainly encourage people to do it. It's interesting. You have the same thing on the other side. You can actually overstress your body. Marathon runners have a higher risk of upper respiratory tract infections after a marathon because their body is kind of so depleted that you can do the other way. And so, but you can randomize them to healthier diets, significantly decrease the risk of infection by bolstering the immune system at both ends of the extreme. You'll only help your immune system doing moderately intense exercise like walking. I recommend 90 minutes a day.
Wonderful. And so getting enough sleep, exercising, nutrition. You mentioned a study with 83 volunteers where they tested a vaccination. The volunteers were between the ages of 65 and 85, and wow. There was a control group, and the experimental group, they were given 3 servings of vegetables, fruits and vegetables daily, and there was a significant difference in terms of how protective the nutritious food was, right?
Yeah. Isn't that amazing? And this wasn't cutting out meat. Just adding a few servings of fruits and vegetables to one's diet can so boost one's immune system they got a significantly improved antibody response to the vaccination. And that's one of the problems. So elderly individuals are those most at risk for respiratory infections. At the same time, their declining immune systems may make vaccines less useful. Their body is less protected against a vaccine, and they're the ones we need to be most protected. And just by giving a few extra servings of fruits and vegetables, all of a sudden vaccination worked better because their immune system was more robust. And again, what are the side effects? Just good side effects, right? Fruits and vegetables have all sorts of benefits, anti-inflammatory, antioxidant benefits for all the organ systems of the body. But you won't hear about any of this because no one makes any money off of it, right? If the benefits of fruits and vegetables could be fit into a pill, that would be a pill you would buy some stock in.
And there certainly are a lot of people trying to sell us pills telling us that they have those benefits.
That's true, but they pale in comparison.
Yeah, it's frustrating for me. Everyone comes to me asking about, well, should I take this pill and that pill? And I go, well, why don't you just eat the vegetable instead?
Aisle, not supplement aisle.
Can we talk a little bit about obesity and the risks that are involved with that?
Yeah, the excess risk from having excess body fat, we're actually not sure exactly what's going on. We do know that those with excess body fat, particularly abdominal fat, that deep visceral fat, have higher levels of inflammatory mediators like C-reactive protein, which suggests they have higher levels of this low-grade smoldering inflammation. And since most of the damage in the lungs done during a severe COVID infection is actually not caused by the virus directly, but actually caused by our own immune system, having that pro-inflammatory milieu may accelerate that damage. It also may be something called epicardial fat. There's actually fat on the heart itself, and obese individuals, overweight individuals who have excess body fat also have more epicardial fat, and maybe the fat on the heart itself may be contributing to the inflammation in the chest. And then there's something called obesity hypoventilation syndrome, where you just have so much excessive fatty tissue in the upper body, you're actually restricted in terms of your breathing capacity. All of those may be contributing to this dramatically higher risk. In fact, it's one of the reasons we think why the United States is suffering disproportionately around the world. Yes, in northern Italy, they had a relatively older population and suffered because of it. Well, here in the United States, we have one of the fattest populations, and unfortunately, that is putting people at risk, not just down the road from diabetes and osteoarthritis and on down the list, but right now from infection. Look, we have all been telling people to start eating healthy, living healthy for years now, but it's really come to a head now. And hopefully this will stress to people how important it is to stay healthy. You can't just wait till you get disease and try to claw yourself back to health. It's better, an ounce of prevention is worth a ton of cure. And I'm so glad that you're there in Dallas to share this important information with folks down there, and look forward myself to eventually getting back down to Dallas and sharing this as well. So, but for those people who are interested in losing weight, I keep wanting to say my latest book, but as of Tuesday, that's not my latest book. How Not to Diet is 2 books ago. Yeah, all the information you can need, all the tips, tricks, tweak techniques to accelerate the loss of body fat. And so I would encourage people to check out that resource. And I believe that's the talk I was going to give down in Dallas. And I still may very well do that. Maybe we'll reschedule for the spring.
Yeah, that sounds great.
You mentioned the things that put people more at risk for COVID-19, which is obesity, hypertension, diabetes, and coronary artery disease. Well, guess what? That's the same thing that my patient population has, which is vascular disease, atherosclerosis. And I think it just drives home the point that all of these things are kind of part of our inflammatory state that we're putting our body in and the damage we're doing. And I love the fact that it's not that we have to come up with a million different solutions to the problem. There's literally one solution to the problem, right? And that's to be healthier through a better diet.
So for the last 100 years, from 1919 to 2019, every single year in the United States, the number one killer of Americans was heart disease. But that wasn't true in 1918, and that probably won't be true for 2020. But you're right, the exact same diet that can prevent, arrest, and reverse these chronic conditions like coronary artery disease is the same kind of diet that's going to reduce our risk of pandemic infectious disease as well.
Now, I would like to ask another thing too. You address kind of a 3-pronged approach to working on this. Can you kind of build on that for me?
Well, if we want this, the only way the pandemic ends is unless the virus just disappears, which would not be unprecedented. But the way most pandemics end is this concept called herd immunity, where a critical portion of the populace becomes immune to the virus. An infection can only, churn through a population if there's enough susceptible individuals for the viral sparks to jump from one person to the next. But immune individuals, those who can't get it or can't transmit it, act as fire breaks for the disease, kind of control rods in a nuclear reactor to break the chains of transmission. Now, ideally, this is accomplished through mass vaccination. Vaccines are a way to fight fire with fire, using the virus to fight the virus by acquiring the benefits of infection, immunity, without facing the risks, disease, and death. Now, without a vaccine, herd immunity is only achieved the hard way through mass infection. But look, you can't get the virus unless the virus can get to you. That's why I talk about all the just common sense measures we can take to reduce our risk during this precarious time.
And that's kind of primarily what you focus on in this How to Survive a Pandemic. I attended your 4-hour webinar that you recently did, and I know that you've been doing a lot of live presentations, also just, really sharing a lot of information with us. You focus on basically, what we can do to prevent our defense strategies, meaning, social distancing, respiratory etiquette, hand sanitation, basically avoid getting sick. and also being prepared. So I printed out the your pandemic flu planning checklist, because I thought this is important for us to prepare in case this either comes back as a second peak, or maybe preparing for the next pandemic. What would you advise us right now? People aren't wearing masks necessarily at grocery stores, and they're having social gatherings, and people are pretending like the pandemic disappeared.
Well, I mean, so it depends on the person, depends on your individual risk, it depends on who you come in contact with. If you're over the age 65, or if you come in contact with those over the age of 65, or those with these critical health conditions, then it's irresponsible for you to crowd together in public. The primary mode of transmission are these respiratory droplets, not only caused and sneezed out, but exhaled out, breathed out. In normal conversational speech, you eject these tiny little respiratory droplets that can contain virus, and for 48 hours before you show symptoms, before the fever, before the cough, you feel perfectly fine, you look perfectly fine, but maybe exhaling virus with every breath. That's why it's critical as a sign of respect to wear a mask or face covering. It's not to protect you, it's to protect others from you. You don't know if you're infected. You don't know who's infected. That's why we're trying to keep as many people away from as many people as possible until we have the kind of testing that's necessary to really get at what the levels of infection are in a community. And, look, if you're young, the risk of suffering a severe course with this disease is exceedingly low. Those in your 40s and 50s, like 1 in 1,000 chance of dying, less than that. And so, look, if you want to take your risk, that's your prerogative. But then, don't go visit the grandparents. You could put those in your sphere at risk. So you're not just taking risks upon yourself. You're taking risks upon everyone you come in contact with. And so that's why social distancing is still important. Wearing face masks, particularly in indoor, crowded, confined spaces. That's where the majority of transmission is happening. It's not that you can't go outdoors. We should all be going outdoors, all be exercising, enjoying this beautiful weather. But it's all about just keeping our distance from people until we can get this virus better under control.
And I heard you say that, what to do if you're traveling long distance and with people in the vehicle. Avoid flying as well. Is that something you...
Well, that's the problem. So, planes are kind of the epitome of a confined, crowded indoor space. I think people have this sense that there's nobody on planes, and so they'll be like the only one. But that's not true. What they've done is canceled so many flights. They're only flying when they pack up the plane. Now, they're not having people in the middle row, but you walk onto any plane these days, you're going to see every single window seat, every single row seat taken, just because otherwise it's just not economical for these airlines to be flying. It just costs so much in jet fuel. So, this is not a risk-free endeavor. If you have to travel somewhere, safest is actually do it in a car alone, rather than taking the train, rather than taking public transportation, rather than taking a plane. If you have to have someone outside of your household in a car, you can roll down the windows or something, anything to improve ventilation. Not much you can do in an airplane. You're relying on the ventilation system that they have. You don't know who's behind you. You don't know who's in front of you. It's probably safer to be in a window seat than an aisle seat, just because when people go up and down the road, they're not going to be breathing directly on you. It's probably better to not go to the bathroom if you can, because again, you've got to be past people on the way back and forth. We know it's in stool that can be aerosolized in that tiny enclosed space in the bathroom. So there's some small things you can do to reduce your risk, but probably just not a good time to fly. Again, particularly if you have these premorbid conditions, if you're older, or if you're coming in contact with anyone who's elderly or frail.
Got one more thing I'd like to ask you, and maybe put on your future prediction cap. And what's your thoughts on, it's inevitable. You said this is just a warm-up for us. So how soon are we going to see something big? What is it going to be like? What's the likelihood of something even worse happening?
Oh well, I mean, there's a good likelihood it'll be worse because right now we're dealing with a Category 2 pandemic. The CDC has a pandemic severity gauge very similar to kind of the hurricane severity index. Categories 1 through 5. 1918 was a Category 5, a 2% fatality. Swine flu in 2009, that was a Category 1. Right now we're dealing with a Category 2, a 0.4% case fatality rate. But I mean, as you can see, we're at the lower end, right? So we are certainly at risk. We have H5N1, H7N9, these very deadly bird flu viruses. Some of the deadliest pathogens known, similar to what you'd get with untreated HIV or Ebola, right around a 50% case fatality rate. And these are pathogens that can infect a significant percentage of the world's population within a matter of months, should they acquire easy human-to-human transmissibility, which would simply end civilization as we know it. I mean, as bad as COVID-19 is, there's still groceries being restocked in the shelves. We still have electricity. Water is still being purified. Doctors and nurses are still showing up to work. This is, as pandemics go, a relatively mild pandemic. We got lucky. We may not get lucky next time. That's why we need to do everything we possibly can to reduce that risk. And that all comes down to what we as a species are putting on our plate. And so I so appreciate all the work you're doing down there in Texas and look forward to joining you maybe next spring.
Thank you. And thank you for putting together this whole package of how to survive a pandemic.
Thank you very much, Dr. Greger. You take care.
Absolutely. Stay safe.
Bye-bye.
Keep up the good work.
Thank you, Dr. Michael Greger, for all the wonderful tips on how we can stay safe and how we can prepare for future pandemics. Please let us know in the comments below how you have been taking care of yourself. Thanks again for watching. Make sure to subscribe for future videos like this one.